Welcome to Impact OC, the only program showcasing the people and organizations shaping Orange County. With your host, Don Camber.
Hello, live from the OC Talk Radio studios at UCI's Beal Applied Innovation Center. I'm OC Talk Radio Public Affairs Director Don Camber with another great guest positively impacting our community. February is American Heart Month, and February 7th is National Wear Red Day to raise awareness about cardiovascular disease as the #1 killer of women. Today, I welcome American Heart Association speaker, Dr. Eileen Barsigian Alfara. She's a board-certified UCI health cardiologist specializing in interventional and integrative approaches to heart disease. Her clinical interests include women's heart health, preventative cardiology, cardiovascular imaging, and pharmacology. Thank you, Dr. Barsigian, for being on Impact OC.
Don, thanks so much for having me here. I'm so excited to speak about this cause, something that's very important to me.
February is American Heart Month. What's the theme? And please talk about National Wear Red Day.
This year, National Wear Red Day is Friday, February 7th. We encourage everybody to wear something red, even if it's just a hint of red, to raise awareness. This way we come together as a community to show our support, raise awareness, and make an impact, hopefully together, so that we as a community can talk more about the #1 killer in America, which is heart disease.
And what are cardiovascular disease and stroke?
Great, I'm glad you asked me that. Cardiovascular disease is basically disease that involves the vessels of the body, and which area or which organ they supply determines what kind of impact you're going to have. So if the vessels in the heart are diseased, you're going to have heart disease. If the vessels to the brain are diseased, you could have a stroke. So in general, it's related to the vascular health of your organs. So heart disease in particular is generally thought of as plaque buildup, or a term called atherosclerosis of the blood vessels that feed the heart muscle. So oftentimes, broadly speaking, we think of heart disease as plaque buildup in the heart arteries. But of course, heart disease encompasses other heart problems as well.
How do you know if someone's having a heart attack versus a stroke?
There's a spectrum of heart disease, and heart attack sort of the one end of the spectrum. Heart attack is a sudden blockage of blood flow to your heart muscle due to a blood clot in your heart arteries. So oftentimes it's a sudden onset of symptoms. Typically in both men and women, the most common symptom is chest pain or pressure. But it could vary. The associated symptoms can vary depending on the gender or the age or the risk factors of the individual. So heart attacks are generally that full sudden obstruction of blood flow to your heart muscle. And it's pretty robust and don't feel well.
But when a person has a stroke, what happens?
When a person has a stroke, it's the same concept. There's a blood clot that occludes the blood flow to the brain this time, rather than the heart, to the brain. And there's two types of stroke. So one that's the most common is ischemic stroke, and that is a blood clot limiting blood flow to one area of the brain. And so the area that doesn't get the blood flow is usually responsible for the function of the body that brain area supports. For example, if the blood clot is occluding blood flow to the area of speech, you're going to lose speech. Or if there's sometimes it's one-sided, you have limbs that don't work, it's a decrease in muscle function. So a variety of manifestations of stroke. The other kind of stroke is a hemorrhagic stroke, which is often associated with a blood vessel in the brain that bursts and causes a rapid outflow of blood in a enclosed cavity of the brain. And so that has a different consequence. Well, same consequences, but a different pathophysiology of how it happens.
Can a person have a heart attack and not even know it?
There are versions of that, yes. It's not, oftentimes we can really dig back and there was that one moment, an event. Sometimes we're thinking retrospectively. But in theory, yes, you could have a silent myocardial infarction. But I would say that most of the time it's the symptoms that are not very typical that people don't really identify. For example, you could have sort of a loss of functional capacity. You start getting more tired easily when you take that walk or do the same stairs you've been doing for a long time. But now you're compensating. Now you just take the elevator because you've started compensating because you can't climb up those stairs. So oftentimes, rather than like a complete silent event, there's just these subtle changes, often associated with exertion or something that gets the heart rate up that you don't do as well as you did 1 month, 3 months, or 6 months ago.
So if someone experiences that, they definitely need to get checked because it very well could be a form of cardiovascular disease.
100%. Any exertional symptoms are concerning for heart disease. Anything that is symptomatic when the heart rate goes up. So even we talk about exertion all the time because that brings the heart rate up and all of a sudden you feel something funny, that chest tightness or chest discomfort or inability to hit that same distance, back pain, but then when you rest and your heart rate goes down, it goes away. Those are the little giveaways. Even sometimes women may manifest things like what they call heartburn or epigastric pain. But heartburn generally happens after a meal, 30 minutes after a meal, for example. It doesn't happen on its own after exertion. So if you feel something that you think is heartburn, especially if you've never really had heartburn before, then you need to think, especially if it's not associated with food intake, that perhaps it could be a manifestation of a heart artery blockage. And so along with that, some other symptoms are neck pain, jaw pain. Again, oftentimes it's with exertion relieved with rest. That's our go-to sort of definition of what we call angina, which is chest pain or pressure from the blockage in the heart arteries. It comes on with exertion, relieved with rest, or sometimes medication that you might be given by your cardiologist called nitroglycerin.
How can a person develop cardiovascular disease?
There are well-established cardiovascular risk factors. Several of them. A few of them are non-modifiable. You can't do anything about your age, and you can't do anything about your gender, but there's things you could do about the remaining risk factors. The most common are smoking, don't smoke, high cholesterol, particularly LDL cholesterol, as well as high blood pressure or high blood sugar. So you can prevent the high cholesterol, diabetes formation, and high blood pressure, or once you have it, just make sure that you've had your regular routine follow-up so that you could keep it at bay, keep it controlled. And if you can control it, then it's your gold.
The relationship between blood pressure and cardiovascular disease, because every time you go to the doctor, they take your blood pressure. But if the blood pressure isn't so great, couldn't that mean you potentially could be a candidate for cardiovascular disease?
You know, blood pressure is very easy to manage. We have great medications and multiple medications, along with a big category of people who are in the range where it's reversible. They just developed high blood pressure that they can integrate diet and lifestyle modification and almost reverse it and improve it. And it is a known risk factor. Any way you can get control of it is how you prevent the chronic effects. And think of if you have persistently high blood pressure that's not managed, it's like a constant trauma on the blood vessels. So over time, the blood vessels can get thickened, they'll be less compliant, they could get damaged, kind of introduce opportunities for plaque to start forming. So that is why long term, it's important to control high blood pressure.
And when the plaque develops, that can cause a heart attack.
The plaque starts developing. Usually the first step is something called endothelial dysfunction, where the lining of the blood vessels just gets a little break, a little damage, and then that allows the introduction of fatty molecules to deposit, and slowly, if it's not well managed, those could grow. And if it gets big enough, it starts encroaching into the blood vessel, blocking blood flow. And that's when, if it's severe enough, you'll get chest pain. But sometimes it doesn't get to the point. If you just needs the right environment, it's severe, but just needs the right environment for that plaque to rupture. And that's the sudden event of a heart attack. It's really just one moment in time where just with the snap of a finger and that life changes. And again, it's really, this is meant to raise awareness because it's very preventable. We have great ways to stabilize plaque, prevent progression of plaque, prevent the recurrence, even if someone's had a heart attack, prevent the recurrence of a second heart attack. It's really just to raise awareness that it's very controllable and preventable.
Are the symptoms different for men than for women?
Classically, men can relate to the symptom of chest tightness, chest pressure, elephant sitting on my chest description that we've seen often, readily available. With women, the still most common symptom is chest pain. However, they'll have perhaps associated nausea or a significant fatigue during the event or after the event. They might have lightheadedness, that heartburn they might describe. So a constellation of symptoms that is not primarily what men describe. And same goes for elderly and diabetics. They have more subtle symptoms than the classic symptoms that men may describe.
Describe what a stroke is.
A stroke is a lack of blood flow to your brain. That's the ischemic stroke. That is the typical, most common stroke. And usually early identification of stroke, just like with heart attacks, is key. We always say for the heart, time is muscle. And same is critically important for the brain. If you notice a family member with a change in their speech, confusion, any asymmetry, or you see their face is different on one side than the other, but mostly like inability to find words or a confusion, someone you wouldn't expect. Even I've had patients describe that they were getting suddenly odd texts from their family members, texts that didn't make sense. There's confusion in their writing. Those could be signs of a stroke, and it's important to act immediately.
So what are the steps to CPR that could save a person's life when they're having a heart attack?
CPR is really a tool you have with just your hands. You can save a life. You just have to be aware. You don't even need to be like formally certified for CPR. Just have some strong foundation, and there's great organizations that can give you that, such as the heart.org, the American Heart Association, to just when cardiac arrest happens, the heart has stopped. There is no blood flow to the heart. And so what you do with CPR is you keep blood flow going to the heart, to the brain, until help arrives. So, and that's what those chest compressions are. They just keep pumping blood flow to the brain and heart so you can ensure the best possible outcome in such a dire scenario.
Can you describe what it looks like to do it?
Sure. Usually, again, to somebody who's had no practice at all, you want to have the patient on a floor on something hard, flat on their back, and chest compressions sort of mid-sternum, and push hard, push straight down, and continue to do that until help arrives. And in the meantime, ask someone to call 911 and look for or start identifying an automatic external defibrillator, AED. You may have heard about. Thanks to organizations like the American Heart Association, there's just increased awareness and presence of this equipment in areas that have a large general public, for example. And you can ask someone else to grab the AED, because those there's few types, and oftentimes they're pretty easy to apply, even to someone who may not know or have ever seen one. As you do CPR until someone brings that device, opens it up, then you apply it to the chest, and it usually guides you. It tells you what to do as the next steps. But to just think to go and grab an AED while you wait for paramedics is also an important next step.
Describe what it looks like to use it.
They're it's a box. It's attached to a wall, usually well marked. You grab it, you open it up. Usually it'll have like a computer piece and then two things that you apply to the chest, if not just one. It's just there's a pictorial on the piece and where you're supposed to apply it. Once you apply it, you turn on the device and it'll tell you step back, assessing rhythm, for example, charging and delivering. There's several different versions. And in a formal class where you learn CPR, they will help you get familiarized with these. But the most important thing here is to just know that they're available and at least give the best chance to get blood flow established even before the paramedics arrive, which was often within minutes anyway.
On what ages can it be used on?
Oh, it could be used on any age. Anybody with a cardiac arrest, their best chance to revitalize them and reestablish blood flow.
I've heard that when people do hands-only CPR, they're worried that they might hurt the chest when they do chest compressions. Is there a concern about that?
I think you have to remember that that patient is lifeless at that moment, and whatever you could do, even if you break a few ribs to make sure blood flow is getting to their brain and to their heart, is their best chance of survival. And does it happen even in the hospital setting? Sure, but it's just you weigh it against the other option.
Can you give us a few stories of people who've used the AED and they were successful?
Oh, we have that happen regularly. I mean, my stories, honestly, of seeing that applied is the same that the general public has seen, whether it's like on the soccer field or in a basketball game. Those are the ones where they're very well televised. Since I'm in the hospital, those are the success stories. Sometimes they don't even make it to us. I've definitely seen amazing outcomes of bystander, good quality CPR, where we eventually get the patient's blood flow, heart up and going, and they don't have any obvious residual cognitive defects from being down without blood flow. So that bystander, good quality CPR is key.
What could happen if they don't get it soon enough and they're still alive? You said cognitive decline?
Right. The brain needs blood flow. After, a few minutes, it starts a lack of blood flow. It can be affected. So when you start CPR, your main goal is keep that blood flow to the brain until the paramedics arrive, and they could, if you don't have access to an AED, they can apply it and restore blood flow, or even continue CPR, good quality CPR, until you get to the hospital.
Can a person have a heart attack and a stroke at the same time?
Gosh, we're always puzzled when this happens, but it occasionally does happen. It could be where the stroke is the initial manifestation, but the stress of a stroke triggers a heart attack. So it can happen. Oftentimes we'll treat the vital organs, whatever we need to do, without harming the other issue.
So what kind of lifestyle changes can people make in their lives to avoid developing cardiovascular disease? I realize they can still do it, but if they're going to make a concerted effort, what should they do? How should they live their lives?
I think prevention is key. While we have these life-saving measures, it'd be so great to just not even get to that point. Even if you have plaque that grows slowly, we can manage that. Just avoid a heart attack. Anything we could do just slow the progression of heart disease. And it does come to your day-to-day choices. Your day-to-day choices are healthy food choices, regular exercise. The recommendation is 30 minutes a day, 5 days a week of moderate intensity exercise. You can also interchange that with high intensity exercise a couple of days of the week. But it's the regularity but the 30 minutes, moderate intensity exercise, 5 days a week, eat healthy foods, healthy choices, foods that are lean meats, high in vegetables, low in sugar, refined sugars, and saturated fat, low in saturated fat. Avoid the sugary drinks as much as possible. And of course, it's never too much to say don't smoke.
What's the role the American Heart Association has in educating the public about this?
They reach far. They're not only national, global, They standardize ways of saving lives, delivering messages in a way that patients can understand. They're a trusted resource backed by research, scientific evidence that you can go to their information sites and feel that you're getting the correct information, especially in this day and age where you could just be bombarded with one angle or another and get more confused. Always go to them. And there's no one magic trick. It's just living your day-to-day life as healthy as possible. We can talk a little bit about stress, really minimizing stress. Although it's not described as a classic risk factor, it certainly plays an impact. If you are under constant stress, you might make poor healthy choices. You might have high cortisol levels. You might have a little elevated blood pressure, especially sometimes episodes related to a stressful event. And then it might interrupt your sleep. So I think more and more we're recognizing how important it is to manage that stress so that it doesn't trickle into bad health, long-term health.
Is there an average age a woman develops cardiovascular disease?
In general, postmenopause is when women sort of catch up to men in terms of their heart disease risk. We're protected to some degree premenopause. That's not to say that there aren't women who have heart blockages before they reach menopause, but general postmenopause, women catch up to men in terms of numbers.
So is the idea to try to avoid sudden cardiac death?
That's a low bar to aim for, but yes, that you can't really come back from that. It's always like a great story, but it's not a good one. So sudden cardiac death is the key. Listen to your symptoms, control your risk factors. But I think there's such a long road before you get to that point, and so much you could do to prevent that. And even if that means you have high blood pressure, for example, and you've tried 6 months of diet and lifestyle modification, and perhaps you didn't get to that great number that you hoped to, then maybe all you need is this one medication that'll do the job, and you continue to live healthy. It's a lifestyle with health is not a replacement. Medication is not a replacement for that. But as long as you bring those two together, then you again have your risk factor well controlled, and you're preventing heart disease.
And you want to bring awareness to heart disease on February 7th.
February 7th is National Wear Red Day, and I think that we can all come together in unity and show our support for Heart Month, which is February, and also just raise awareness for the number one cause of death in America.
Why did you get interested in this field?
My interest is in the physiology. That's where it first started, sort of the science behind it. That's what hooked me. But I think that I love that it's a full spectrum where you can really not only save a life, but also in the clinic, just one patient at a time, prevent a cardiovascular event. The really sort of day-to-day impact, and then the acutely ill, very sick patient impact. And the women's heart disease is a thing. It is there is not enough known about women's heart disease, at least universally. Women do present differently. They have different symptoms. They have different needs. They often may. It's not always when they come to the ER or the doctor's visit that is as less apparent. Sometimes even at home, they suppress their symptoms or justification for why they're feeling that way, and so they delay their care as well, or sometimes they are burdened with a lot of other people who they have to care for. So it's important not only in the home to recognize it, but also in the clinical setting.
Is the number of women dying from heart disease going up, or has it decreased over the years?
I think overall we're doing a better job. We're preventing more. We're treating risk factors better, but it's certainly not where we need to be. In some ways, although there aren't a lot of silent heart attacks like we talked about, it's certainly a silent killer in a way, because the risk factors are silent. You don't feel a pain. So you don't feel a pain from high cholesterol, to be exact. You don't feel a pain with like slightly high blood pressure, but for years. So you just have to get routine checkups to prevent the worst outcome from happening.
But by the same token, if they're taking medication to control that, which apparently is hurting them, will they feel better afterwards?
There's certainly times where you'll feel better. You can get chest tightness from just uncontrolled high blood pressure. You bring that blood pressure down and the chest pain gets better. So there's definitely scenarios where you will feel a difference.
Is there a movement to educate young girls who become young women about heart disease so that they can develop good habits?
I think we try so hard. My colleague and I, who are part of the Women's Heart Disease Center at UCI Health, we have been going to universities to educate the college students there, and while our audience is women, because it's targeted for women's heart disease and health awareness, we love it when the men show up and support the cause as well. So it's grassroots, but we try.
How can people get more information about heart disease?
I would refer to the American Heart Association and their website with heart.org is a great resource. They have all kinds of links for solid, good, reliable information.
How young can you be to learn how to use an AED?
There are children as young as 9 years old who can learn to initiate CPR and perhaps get comfortable with an AED, or at least take the next step. So 9 is pretty impressive, but it's doable. So they might be the only person that's there if something happens to you. And if there's even that slightest chance that you can have fast help, I think it's worth it.
And is that the same with hands-only CPR?
Sure. I mean, I think getting help, getting AED, getting CPR, depending on the 9-year-old. But you got to give it a chance. Our goal, hopefully in the next year with American Heart Association, is to get at least one more family member who knows how to do CPR. Just make it more common. In fact, I have one year given CPR classes to my family as their Christmas gift because I figured they better know how to do CPR if something happened to me.
Thank you, an American Heart Association speaker, Dr. Eileen Barsigian-Elfara, for being on Impact OC. And I thank everyone for tuning in. I'm OC Talk Radio Public Affairs Director Dawn Camber. Have an impactful day.
You've been listening to Impact OC, the only program showcasing the people and organizations shaping our community. Right here on Orange County's only community radio station, OC Talk Radio.